Bismillah ar-Rahman ar-Rahim. Ventilator waveform analysis. Inspiratory pause and volume controlled ventilation and pressure controlled ventilation. What is the difference between the two? This is an inspiratory pause and volume controlled ventilation. It is preset. And here, this inspiratory pause, the demand valve is closed after the delivery of the preset tidal volume and remain closed till the end of this inspiratory pause where the expiratory valve opens. During this inspiratory pause, so no flow is zero, and the tidal volume is trapped, and this forms the plateau pressure or the alveolar pressure of this trapped tidal volume. And this through this plateau pressure we can measure the total compliance of the respiratory compliance. Here another important point, if this time of the ventilator inspiratory time is short and the patient on the neural inspiratory time of the patient is large, he can trigger another wave during this pause. An inspiratory pause in pressure controlled is developed. We do not preset it, but the long inspiratory time may develop it, because here, according to this driving pressure, it is controlled, or if it is assessed control, the driving pressure of the machine and driving pressure of the patient, the two will develop some sort of tidal volume, and this tidal volume will increase, and when the alveolar pressure equals the airway pressure, flow stops, so the flow is zero. This is the predicted tidal volume for these two pressures, and this is the predicted time for this two pressure and for this tidal volume. So the remaining time is the inspiratory pause, and we know that the demand valve opens with the triggering and closes at the end of the preset inspiratory time. So during an inspiratory pause, the demand valve is open, so the patient can take another breath without triggering. And at this same time, according to the drop in the alveolar pressure, the flow will increase to maintain this airway pressure constant, and these two cycles will be terminated and ended by closure of the demand valve at the end of the preset inspiratory time, and the exhalation valve will open for the exhalation of the two cycles. This is another example. Long inspiratory time, 3 seconds. Long inspiratory time is inspiratory pause, and the patient took another breath. Here, long inspiratory and patient took another breath with late cycling and early cycling, as we have mentioned before. And the patient, this is the inspiratory pause, and the patient took another breath without triggering. And according to the drop of the alveolar pressure, the flow increases to keep this pressure constant. And by the end of the inspiratory time, which is 3 seconds, the demand valve closes for the two cycles. And at the same time, the exhalation valve opens for the exhalation of these two cycles or two presses. Thank you.